Hey, my name is Christy Hagee, and I'm going to present to you a crash course about asthma. The definition of asthma is a lung disease characterized by airway obstruction that is reversible but not completely in some patients, airway inflammation, and increased airway reactivity to a variety of stimuli. There is no cure for asthma, but its symptoms can be controlled, and asthma can change over time. So the airway inflammation leads to the epithelial denudation, collagen deposition beneath the basement membrane, mast cell activation, mucosal edema, increased viscid secretions, and smooth muscle contraction. Looking at the anatomy of the lungs and what happens during an asthma attack is you look at the top right corner, that is what your bronchial tube normally looks like, but if you look underneath that picture, you will see an increase in production of mucus. That increased mucus lines the inside of the bronchial tubes and narrows airway flow. The smooth muscles also contract. So during an asthma attack, the inside walls of your airways and your lungs can become inflamed and swollen, and the membranes in your airway linings may secrete excess mucus. This results in an asthma attack and makes it harder for you to breathe and will cause you to cough and wheeze. If you click on the video, you will get a quick review of what exactly is happening during an asthma attack. We're going to move forward to description, characteristics, and the courses that you will see in asthma. You have intrinsic and extrinsic asthma. The intrinsic asthma is seen more in adult onsets and occurs in patients who have no history of allergy. It develops mostly in middle age and has a less favorable prognosis. There are respiratory tract infections or psychological factors that seem to be a contributing factor to this. The airways are hyperactive, and patients may present with extreme dyspnea, orthopnea, and agitation. Extrinsic asthma is seen in the pediatric group. There is a known allergic asthma associated with it. There is a history of hay fever, eczema, and a family history of the disease, and a positive skin test reaction to allergens. It can be managed through pharmacologic therapy and allergen-specific immunotherapy, and environmental control is usually beneficial. The next three characteristics I will be talking to you about is going to deal with occupational asthma, drug-induced asthma, and exercise-induced asthma. I find interesting that the occupational asthma appears while you are at work, but when you go home for the weekend or you go on a vacation, those symptoms clear up. But then when you come back to work, they reappear. So individuals affected tend to have a progressively more severe attack with exposure, and there is usually a positive skin test reaction to the protein allergens in the work environment. Drug-induced asthma ranges from mild rhinorrhea, which is your typical runny nose, to respiratory arrest requiring mechanical ventilation. I find it interesting that non-steroidal anti-inflammatory drugs such as ibuprofen may induce asthma in the aspirin intolerant patient. Also, food additives such as yellow dye number 5, MSG, hops, which is found in beer, can cause asthma. Bronchoconstriction may constitute part of an anaphylactic reaction to a drug, such as penicillin. Other drugs, such as opiates, may cause direct degranulation of mast cells. Exercise-induced asthma usually occurs within the 3 minutes after the end of exercise and can resolve in 60 minutes. Some of your top 3 physical activities that can cause asthma is running, jogging, and playing tennis because of the vigorous activity level. Heat loss, water loss, and increased osmolarity of the lower respiratory mucosa are believed to stimulate mediator release from basophils in tissue mast cells. Mediator release produces airway smooth muscle contraction, and bronchospasms occur, like I said, within the 3 minutes after the end of exercise and can resolve in 60 minutes. So a little bit of story about me was a couple of years ago. I do have been diagnosed in the past with allergy-induced asthma, but did not know that I had or can get exercise-induced asthma. And so I was doing one of my long runs, and I was about 4 miles into my run, and I had an asthma attack. I had chest pain. It was tight. I could not, my air could not get exchanged well. And what was interesting was my eyes would start running, my nose would start running. And so I did not have an inhaler on me, but I tried to stay calm, focus on my breathing. In moments, it relieved itself. A list of your symptoms. If you want to press the play button, there's a video showing you what the sound of wheezing may sound like. Everybody's wheezing is different, but some may sound like they're blowing a whistle. Others may sound like it's just I don't know, it's like a hollow type sound. But some of the symptoms will cause you to have trouble sleeping due to shortness of breath, coughing, or wheezing, as I said. Can be activity dependent, or having a cold or flu can cause you to have some asthma type symptoms. So therefore, if this happens, you need to use a quick relief inhaler. And these symptoms differ from one person to the other. So just something to keep in mind. Here's a list of asthma triggers. As you can see, the bugs in the home, like I mentioned, the cockroach waste, how disgusting. Cold air, stress, pet dander, exercise, strong odors. These are just a few of the triggers that you may be exposed to. Also, food and beverages like shrimp, dried fruit, potatoes, beer, and wine. Also, gastroesophageal reflux disease can be triggers to asthma. Risk factors are very similar to the triggers, but a blood relative, such as a parent or sibling with asthma, may put you at a higher risk level of developing asthma, and also having other allergic conditions such as dermatitis or hay fever, being overweight, a smoker, around fumes and smoke, and chemicals like farming, hairdressing, and manufacturing. So it kind of puts you up at a higher risk for having. This slide presents you some information of incident rates. 7% to 14% U.S. population is affected by asthma. And it's mostly common in children, but also you can see in adults as well. And the variations between the numbers is not that significant. Mortality rate is 10.7 per 1 million people. So that's approximately 3,400 people. The direct and indirect cost contributed to asthma is $56 billion. I thought that was pretty significant to see. But as you can see, African American population has a incident rate as compared to white and Hispanic population. So the graph here is telling you about the current asthma prevalence by age group, sex, race, ethnicity, poverty status, geographical region, and place of residence in the United States. And this was in the year of 2017. So there is a higher prevalence rate in African Americans, inner city dwellers, and premature or low birth weight children compared to others. Asthma is most common chronic disease of children. So if you want to pause and just take a look at the graph, feel free to. So a spirometry and peak flow meter are a couple of instruments used to help diagnose asthma. So lung function tests often are done before and after taking a medication called a bronchodilator, such as albuterol, to open your airways. If your lung function improves with the use of a bronchodilator, it's likely you have asthma. This is a nice little chart that kind of goes over an asthma classifications and signs and symptoms. It breaks it down from mild, intermittent, mild persistent, moderate persistent, and severe persistent. So if you would like to take a look at it for a little bit, feel free to. So going over treatment and medication, the key to treating your asthma is staying on top of it by taking your medications as prescribed and not letting it go. So if you treat your asthma, you'll have better control over the severity. And the treatment should be flexible and it's based on changes in your symptoms. So following up with regular doctor visits is very important if you're diagnosed with asthma. So a good action plan is to have a journal. That way you can write down certain medications, when you have an increase or decrease in a dose of your medicines, and a list of triggers or steps needed to take to avoid them. If you'll look to the right, you'll have a list of several medications for long-term asthma control. So if your asthma is well controlled, your doctor may prescribe less medicine. If your asthma isn't well controlled or is getting worse, your doctor may increase your medication and recommend more frequent visits. You may press play and listen to the short video on how to handle an asthma attack without an inhaler. The video on this slide sums up how important it is to take asthma serious. It's not just occasional problems breathing. It can become much worse if undiagnosed or let go. If untreated, asthma may lead to bronchitis and emphysema and potentially can lead to death. But through careful monitoring of triggers and tracking your symptoms and medication use, you can keep your asthma under control, and also going to your regular doctor as prescribed. I hope you enjoyed my presentation on asthma. Thank you.